Good evening, everybody. Welcome to blackdoctor.org. Let me know where you are watching from and how you're doing this evening. Drop that in the chat. But remember to share this with your network. And if you have any questions at all, drop it in the chat. It is Sickle Cell Awareness Month, and joining us to chat all about all the things that you need to know about sickle cell is Dr. David Ovesi. He's a hematologist at Cedars-Sinai Medical Center. And again, drop in the chat if you have any questions. So let's welcome Dr. Ovesi. How are you?
I'm great. Thank you for having me, Shamika. I'm happy to talk about sickle cell today.
Well, let's start with that exactly. What is sickle cell disease and how does it affect the body?
Yeah, great question. It's always hard for me to describe something that happens on a molecule and genetic level, but I'll try to break it down.
Okay.
So to start, sickle cell disease is an inherited condition, meaning something that is passed on from generation to generation in your family. And it happens because of a mutation in something called the beta globin gene. It's part of your DNA that is responsible for making hemoglobin, and that's basically the building block of a red blood cell. The red blood cell is one of the three major blood cells that carries oxygen to all of your organs. So not having enough hemoglobin or enough red cells can obviously cause a lot of problems. So these patients, instead of making normal hemoglobin, they make hemoglobin S, which makes the cells easily get deformed into that sickle shape. It kind of looks like a C instead of like a nice big round donut. And those sickle cells get stuck in blood vessels and clog them up. And they can also break up and cause hemolysis and release their contents into the blood. And those two things are what cause severe pain and organ damage, or even strokes and other complications.
Okay, well, what are some key symptoms and signs that people should be aware of? Because I've met a lot of people that they said they didn't know they had it until some signs and symptoms popped up. So what should some people kind of be on the lookout for?
Right, that's tough because sickle cell disease, we kind of refer to it as sickle cell, but there are a variety of sickle disorders. Sometimes you can just have sickle cell trait, or you can have, full-blown sickle cell disease where you're very symptomatic. So there is a spectrum. And it's tough because there's so many different organs that get involved. So the symptoms can be, a wide variety. I think the most common are bone pain, fatigue, and this is usually because of, we call them occlusive events in the arteries that can cause pain in your bones. And just sickle cell patients, by definition, are anemic. They have less functional red cells, and that makes you tired, can make you short of breath. And then, of course, more serious complications can happen that can cause pain in your chest, difficulty breathing, fevers. If you're having a stroke, that could cause slurred speech, weakness in your arms and legs. And then the more chronic complications over time can cause vision changes, leg ulcerations that can be painful and get infected. But there are a variety of things that can happen. I always tell patients that pain is going to be the most prominent, and to listen to your body and not downplay it when it's happening.
Okay. You mentioned the sickle cell trait. What is the difference between that sickle cell trait and sickle cell disease?
So the way you get sickle cell disease is if you inherit one abnormal copy of the beta globin gene from each relative, your mother and your father. So people who only get one mutation from one parent, they would have sickle cell trait. And that means that they inherit a normal hemoglobin gene from their other parent. So they make enough normal hemoglobin to pretty much be asymptomatic. So people with sickle cell trait generally don't have any symptoms of it and generally have a normal life. Sometimes they can have blood in the urine, and this tends to happen if their oxygen levels drop for whatever reason, or if they go to high altitudes. There have been some NFL players who travel to Denver and play at high altitude, and then kind of discover that they have a problem. They have blood in the urine. One football player had an infarct in his spleen and had to get his spleen removed. That's kind of an extreme example, but sometimes people with sickle trait can have funny things happen when oxygen is low. And when you're at a high altitude, your oxygen can be low. but most of the time they are asymptomatic. Now, if you get one mutation from each parent, then your normal hemoglobin is quite low, and pretty much 90% of your hemoglobin is the abnormal hemoglobin S.
Mhm.
Those people have symptomatic sickle cell disease.
Okay. So this is making so much sense to me right now. And I don't know if this is just an extreme case. I'm just going to bring up one that comes to mind because it happened when I was in college that someone said they had sickle cell trait and that when they were in high school, they had a heart attack because of that. Have you ever heard of that happening? Is that just a rare occurrence that could happen?
That would be very unusual.
Okay.
Usually, the events that happen because of sickle trait are in the parts of the body that are most vulnerable to low
Okay.
oxygen. But anything is possible in medicine. We've all seen crazy cases before. But
Okay.
and there's a number of different sickle cell-like disorders because there's other conditions called thalassemia, which is a
Mhm.
different mutation in the hemoglobin gene um, that also can affect patients who have African descent. And so you can have one sickle gene and one thalassemia gene. And depending what the thalassemia mutation is, you may have something in between sickle trait where you don't have any symptoms and sickle cell disease where the symptoms are severe. There are some people who can have a more mild form of sickle cell disease. But some people who have both sickle and thalassemia mutations can have the same severe side effects as others. So there are a number of different disorders. So it's important to clarify with your hematologist what exactly you have and what you have to look for, because everyone has slightly different complications that can happen.
Okay. So how is sickle cell disease diagnosed? And then what age is it usually identified? Because I don't know if you find out in childhood or later in life.
Usually in childhood, I will say that some of these disorders kind of go um, undiagnosed, and usually it tends to be the more mild ones.
Mhm.
But our newborn screening is pretty good now. The test for sickle cell is called hemoglobin electrophoresis. It can tell you the percentage of hemoglobin S in the blood, which would be the abnormal one in sickle cell, and it can also identify sickle trait. Um, we do newborn screening for babies at birth from a heel stick test. Um, so we're detecting a lot more now, and so most people are picked up early on. But babies don't usually develop the symptoms until a little bit later in infancy or in early childhood, and that's because they're born with high levels of fetal hemoglobin, and that fetal or baby hemoglobin is protective against side effects. Um, and if you know that sickle cell disease runs in your family, and if you know that yourself or your partner might be a carrier or have sickle cell traits,
Mhm.
you can do DNA testing during pregnancy, even before birth.
Okay. Is so when you go to the doctor to get blood drawn, is that something they would just check anyway, or do you have to specifically ask to be um, tested for it?
You would have to specifically ask, and I think
Okay.
for adults now, we didn't always have the newborn screening test. So
Mhm.
if you're not sure if you were checked at birth and you have a family history or you have some symptoms, the test is called hemoglobin electrophoresis. And you would have to ask for that specifically. It's not like a routine blood test that we would check just during your annual physical.
Okay. What are some other common complications that individuals with sickle cell disease may face?
So I think the most common complications would be acute pain episodes
Mhm.
and anemia. Anemia is very prominent. Most people with sickle cell disease don't have a normal hemoglobin. Their normal hemoglobin is low. And that's okay. Most
Mhm.
people get used to having a lower hemoglobin.
Mhm.
And we try to kind of figure out what hemoglobin they usually run at so that we try to limit the amount of blood transfusions they get. And the reason we try to do that is because over time, over years and years of having sickle cell, the more transfusions you get, the more iron you get with the transfusion. Every bag of red cells has some iron in it.
Mhm.
And that can build up over time and cause something called iron overload. And that can cause liver disease or cirrhosis or congestive heart failure. So we pay close attention to iron
Mhm.
and to how many transfusions people are getting, and we try to limit them to when they're really necessary. And then I kind of view the complications as acute or kind of serious ones, and then chronic ones that can be serious, but that take longer to develop. So acute complications can happen right away, like infections. We know that patients with sickle cell don't have normal spleen function, and their spleen, the spleen is important to prevent certain bacterial infections. So pneumonias are common as well. And if the sickling of the cells happens in the arteries in the chest and the lungs, something life-threatening called acute chest syndrome can occur. And that usually presents with chest pain and fevers and difficulty breathing. And then, of course, strokes are always emergencies and life-threatening because they can affect the brain and cause patients to be weak in their arms or legs, or even be paralyzed or have difficulty speaking or slurred speech. And then I think the complications that aren't so dramatic that we may not think about, but we try to look for in the clinic when things are going well so that we can identify them early and treat them, are kind of long-term complications from having blocked up arteries, like the leg ulcers, sickle cell eye disease, which is called proliferative retinopathy, that over time can lead to blindness. Over time, breaking of red cells can release toxins that can cause something called pulmonary hypertension or high blood pressure in one of the arteries that goes to the lungs. And over time, that can lead to heart disease. And then just breaking up of the red cells leads to gallstones. And so some patients can be prone to getting gallstones and can have pain on the right side after eating fatty foods. And then there's some bone problems that can happen too, osteoporosis and also avascular necrosis, or kind of death of the bones in sensitive areas that might require joint surgery. And I think the last complication kind of related to blood transfusions, kind of like iron overload, but the more transfusions you get, the more your immune system can identify other people's blood that donate their blood as foreign, and you can make antibodies. And that can make it not only difficult to find a donor who has blood that your body will accept, but it can also run the risk that you get a blood transfusion and it can cause something called hyperhemolytic crisis. Basically, you would get very severe anemia with a very low hemoglobin level, and that can be dangerous.
So you mentioned the blood transfusions, and I'm just curious as to whether or not, I know you said you can get iron overload, but with the anemia, and I don't know if it would, I know I experienced going through iron infusion. So I just wondered if a patient is suffering from sickle cell disease and can you get the iron infusion if they are severely anemic, or would the blood transfusion help with kind of both of those things?
We try to avoid giving iron to patients with sickle cell because for them, the actual red cells that they make are not functional. They, become the sickle cells. So the blood transfusion, does two things. It provides iron, but it also provides normal red cells. And I think providing the normal red cells is the most important thing that they do, so that you don't have as many sickle cells in the body. The extra iron is usually not helping. And in fact, it's usually causing problems because sickle cell patients tend not to be iron deficient. Because they're always anemic, their gut kind of thinks that they need more iron. And so they absorb iron more from their diet. And so when they get transfused, they have no way of eliminating extra iron. So we try to avoid any iron for sickle cell patients. And I think if people do need transfusions, sometimes we do something called an exchange transfusion, where we take some of their blood out and remove the sickled ones, and then give them donated blood back, so that we're not just giving extra blood, we're also taking away the damaged blood, so that hopefully they don't get as much iron, because we're throwing some iron away in their sickled cells. We don't always do that procedure, but it is done for certain situations.
Okay. Well, what are some of the best practices for managing these pain episodes that you were referring to earlier that are related to sickle cell disease?
That's a good question. And this is very challenging because every sickle cell patient has kind of a different cocktail that works for them. So I think once you are under the care of a hematologist who kind of identifies, what doses of pain medicine work for you, and making sure that every time you come in for a pain episode, we kind of identify if something has triggered it. That's kind of the key, because when you go to the ER, especially when you're at, different hospitals, we always try to have patients go to the same place so they get to know them, so they can readily access their medical records, and see what worked for them in the past. But we see and hear from a lot of patients that, they see different ER doctors at different hospitals, and they may get viewed a certain way, that they're drug seeking, that, they don't look like they're in pain, therefore they must not be in pain. And we really try to dispel those myths about sickle cell by making sure that a hematologist is involved in the care. And I think even before the hospital, if you're having pain at home, or if you're trying to avoid a pain episode, avoiding known triggers is really important. So dehydration, any low oxygen state, infections, those are all really important. So if you have an infection, it should be treated. Hydration is crucial. And if you, live in a high altitude state, for example, that would be higher risk. Or if you travel to a high altitude area, or of course, if you have a pneumonia that could affect your oxygen levels, that could bring about a pain episode. But once you're in the hospital, I found that early use of a patient-directed pain pump called a PCA is helpful, because you can put settings on the pain pump so that you can't administer too much pain medicine to cause an overdose, but that the patient has some control over when they need more pain medicine. And I found that if you use it early, it tends to get the pain under control faster. And I think some doctors are hesitant to do that because, there's kind of preconceived notions about what that means, and that you're giving too much. But early use of a pain pump, IV hydration to keep patients on fluid so they're not dehydrated, using oxygen if they're in a low oxygen state. And there's this little plastic device that you might see in the hospital called an incentive spirometer that patients, we ask them to just breathe in and out. It's kind of like lung rehab. It's exercise for the lungs so that you don't develop pneumonia in the hospital. That's really important while you're sitting in bed and hospitalized for several days or even weeks, that you don't get a pneumonia. We really try to avoid pneumonias in sickle cell. And then, of course, people who get these episodes often, where they're in and out of the hospital, they really should be on disease-modifying medicines that can reduce the frequency of the events. So hydroxyurea, L-glutamine, Oxbryta, these are all medicines that have been proven in clinical trials to cut down on the amount of pain episodes and limit hospitalization.
Okay. Well, how important is regular medical care in the management of sickle cell disease, and what would that typically look like for a patient?
I'm glad you asked, because it's very different depending on where you live and what kind of insurance plan you might have. Not everyone has access to a comprehensive sickle cell center where, you have a hematologist who specializes in sickle cell and may only see sickle cell. Of course, that would kind of be ideal, that you really have someone who sees a lot of sickle cell and they're up to date with everything. A lot of those sickle cell treatment centers also have other specialists like orthopedic doctors who can address the joint and bone problems, psychiatry to help manage the mental health aspects, and a caseworker. But there are not enough facilities and doctors like that to treat everyone. So sometimes if patients live out in rural communities where they can't even see a hematologist, there are actually primary care doctors who are passionate about sickle cell disease, who take care of sickle cell patients themselves, and that works. But I think most patients with sickle cell are seeing a hematologist that, see sickle cell, but they also see a lot of other blood disorders and probably cancers as well. So, they may not have a lot of sickle cell patients in their practice. And so I think whatever your sickle cell care looks like, whoever is managing your sickle cell should be seeing you on a regular basis. Again, tailored to your needs. If you're someone who goes to the hospital for your sickle cell several times a year, you probably need to be seen on a monthly basis to try to keep you out of the hospital. And whoever's managing your sickle cell should be taking measures to both prevent the complications and address them as they come. And I think, most hematologists are not shy about reaching out for help. I have several people I know who are sickle cell experts. Here in Los Angeles, Susan Claster sees all of our sickle cell patients in South LA at Martin Luther King Hospital, a safety net hospital. And she does have a comprehensive sickle cell clinic, and I'll regularly ask her for advice. Diane Nugent was the hematologist who diagnosed me with hemophilia, so I know that she sees all of those blood disorders. She's at the Center for Inherited Bleeding Disorders in Orange County. So I think whoever you see for your sickle cell, just make sure they know who to call if things get complicated.
That's great advice. Are there any new treatments or therapies that are on the horizon for sickle cell disease that you are aware of?
Absolutely. I think the most exciting and the thing we've been talking about in hematology for years, for hemophilia, for sickle cell, is gene therapy. And that's kind of the new buzzword because there have been a few gene therapies that were recently FDA approved for hemophilia, thalassemia, and now sickle cell disease. We don't use the term cure very often in these disorders because nothing has proven to be a very long-term solution. But this is the most promising treatment to try to effectively cure the problem. There are two FDA-approved treatments now called Casgevy and Lyfgenia. They're both cell-based gene therapies where you take the patient's stem cells from their bone marrow and you genetically modify them. One of the treatments, Lyfgenia, uses a virus to modify the stem cells to produce normal hemoglobin. And then Casgevy uses a gene editing technology called CRISPR to do the same thing, to modify the cells so that they start making normal hemoglobin and not hemoglobin S. Both of them are fairly complicated because you kind of have to do what is essentially a stem cell transplant using the patient's own stem cells that are engineered. Even though they're FDA approved, I will say that they're not readily available. They are expensive in the millions of dollars, but I think if you look long-term at the cost of care for a sickle cell patient, every hospitalization is thousands of dollars. All of these medications we use already are expensive, and to help patients avoid all of those things and to make them live longer, I think in the long run, this is the future of sickle cell care, and I believe insurance companies will be paying for these drugs because they'll see the long-term benefit. I think we're still trying to figure out how to implement these drugs and how to train our staff on how to do it, and how to meet the demand of the public. Not everyone's insurance will be allowing this in the beginning. So I know that some of the bleeding disorder centers like CIBD in Orange County are already in the process of getting these drugs. Some of the academic centers in Los Angeles already have them. And I know Cedars-Sinai is trying to bring this into prime time and bring it into our clinic, but it's still a work in progress.
Well, it sounds like there's, like there's hope. That's I think important to offer. What lifestyle adjustments or preventative measures can patients take to help manage their condition?
So we talked a little bit about hydration. So avoiding dehydration, and I think piggybacking off of that, trying to limit alcohol intake. As we know, alcohol can dehydrate you. And just living a healthy lifestyle, period, because patients with sickle cell can have heart disease, they can have heart attacks, they can have lung disease. And so, making sure that they eat a healthy, balanced diet. Not smoking or quitting smoking is very important so that you don't get some of the lung problems. Getting vaccinated is super important for sickle cell, and there are some vaccines that others may not need, especially young people, that people with sickle cell should have. Again, because their spleens don't work properly, they don't have protection against certain bacteria. And many of those bacteria we have vaccines for. So we recommend being up to date with all vaccines, including annual influenza and the COVID vaccine. And I think, as we've touched on, really important to follow up with your doctor and screen for some of these sickle cell complications before they become severe or even before they happen. So yearly eye exams are important. A yearly echocardiogram or ultrasound of the heart to look at the pulmonary artery pressure, to look at the pump function, and to make sure that everything looks well. Mentioning joint pain and doing an MRI to try to identify a joint that might be diseased and might need surgery ahead of time. Just being proactive, listening to your body, and communicating that to your doctor. And don't take no for an answer. I think if you don't feel heard and you don't feel like your doctor is being proactive, it's never wrong to get a second opinion. And so I think a lot of centers, including ours at Cedars-Sinai, you can submit online for a second opinion, and sometimes the insurance will allow for that too.
Where can patients and their families find support and resources for living with sickle cell disease? Because I know there's so many things online. What's the best place to find that?
I think a good rule of thumb, because as you said, everything is on Google, including incorrect information.
Exactly.
I think a lot of the academic hospitals, they fact check all their materials. They sometimes have helpful patient support information that's validated by science, but also in language that people can understand. But there are specific support groups and associations that are more tailored to sickle cell. There's one called the Sickle Cell Disease Association of America. You can find them on sicklecelldisease.org. They provide education. They organize supportive conventions for patients. They're quite a large organization, but there's a lot happening at the local level. If you're more interested in a smaller, more informal support group, there's one that's local called Sickle Cell Warriors. And in fact, I think they're having an educational summit here in Los Angeles right now, the 16th annual, from the 18th to 21st. So there's all sorts of things happening on a local level for sickle cell, and many of them are organized by patients and family members. And so they can help guide patients and families who are going through the same thing and share their stories. And I think some patients who have gone through some clinical trials, including gene therapy, will hopefully be speaking at some of these conventions. There was a big article in the New York Times, came out in December, I think, of last year, talking about a patient who went through the gene therapy and is essentially cured and doesn't have any sickle cell crises anymore. So
wow.
There's a lot out there. And I encourage patients and family members to get involved at a local level, because I don't think anyone can truly understand what it means to have sickle cell unless they are affected by it or one of their loved ones are affected by it.
Someone just asked, I saw the question go by a second ago, but it was if that stem cell procedure would stop, they said SS pain, but would it stop pain?
Yes, and that in fact is the point of the gene therapy, because they looked at the outcomes of what happens after the gene therapy, after the stem cell infusion, and it didn't completely get rid of SS. So you could still pick it up on the hemoglobin electrophoresis test, but you made enough normal hemoglobin from the modified stem cells to not only raise your hemoglobin up to a closer to normal level, it didn't quite take it all the way to normal, but it took it to a high enough level to where pain episodes got reduced by more than 90%. And that's really the name of the game in sickle cell, to reduce pain and to reduce complications. And so we don't really have long-term data yet. These studies are all fairly new. But the idea is that these cells are going to be long-term. They're not going to die off. They're going to live inside your body for the rest of your life. And as long as you maintain enough normal hemoglobin, the expectation and the hope is that the pain episodes will be minimal to non-existent, and the complications that can shorten patients' lives will kind of not happen. So I think if someone has sickle cell and they're young, this is a very promising treatment to do this before you get the organ complications that can limit your life.
Okay. Well, how can patients work with their healthcare providers to create a personalized treatment plan? I mean, I know you mentioned if you're the doctor, you feel like they're not maybe listening or not helping with the type of treatment plan or giving you options, that you always get a second opinion. But what other advice do you have?
I think everyone has different needs, so it's important to
Mhm.
just make your needs known to your doctor. And most doctors are willing to listen. Um, I've found that if you know what works for your sickle cell patient when they have a pain episode, document it.
Mhm.
And this is what I found is helpful for the ER. At least if my patient ends up at my ER, they can read my note. They see, what works for my patient, what dose of morphine or Dilaudid is effective. They
Mhm.
can see my note regarding fluids. They can see my note that says, please consult hematology early. Um, and I think sometimes you can come up with a management plan as kind of a preventive. So we have a couple patients here who get hospitalized quite often, and they live nearby, they're reliable, they can drive here, and they can have someone to, perhaps drive them back from our clinic, where we might set up a monthly visit just to get some IV fluids, maybe one IV dose of a pain medicine, and uh, maybe something else, a non-narcotic pain medicine. And
Mhm.
by doing that, maybe once a month, perhaps we can avoid hospital stays. We also talked about um, a monthly transfusion program. So people who have had strokes, it is recommended that they get monthly transfusions to prevent more strokes from happening. Um, but sometimes if iron overload is a problem, or if the pain episodes are very frequent, doing that exchange transfusion I mentioned, where you take some of the sickled blood out and put some donated blood in, something like that can be a little bit preventive. It's kind of a case by case basis where we decide who should go through the trouble of doing that. It does require a chest port so they can access your veins frequently. But I think every sickle patient, should communicate their history to their doctor,
Mhm.
whether they've had the serious complications before, like acute chest, like strokes. Um, I found that the most vulnerable time in a sickle cell patient's life is when they transition from their pediatric doctor,
Mhm.
where there's lots of resources, lots of funding, lots of care and attention, and lots of support, to the adult world, where all of a sudden they may have to go to work or school.
Yeah.
They're in college and they're juggling all these things. That's a very risky time in someone's life to get lost in the system and fall through the cracks. So, being proactive, setting up with an adult hematologist, and making that adult hematologist aware of your history. And what I found is helpful is connecting that adult hematologist to your pediatric hematologist. I can't tell you how many pediatric hematologists bend the rules and continue to see their patients into adulthood. It's like you're a pediatrician, but you're seeing a 40-year-old patient or giving advice on the side. I think in general, it's good to
Mhm.
have them involved.
Okay.
But, eventually you're going to develop adult problems, and that should
Mhm.
be managed by an adult hematologist.
Okay, that's great advice. Um, you mentioned making that transition to from the pediatrics to adulthood. What role does mental health play in the overall management of sickle cell? Because I'm sure there's a lot of hits to the emotional well-being. And what resources are available for mental health support?
Absolutely. It's incredibly important. If you're not well mentally,
Mhm.
it's almost impossible to get well physically, because it's going to be hard just to get to the doctor's office. Um, I think a lot of our mental health problems in this country are due to access. So, some of those things are hard for patients to change, but there are, um, state programs. We have a lot of mental health services within the county system here. Whether you're at Allevue, at LA County, at USC, or at Harbor, there are safety net hospitals that accept anyone and who have services for you. But check with your insurance plan, whatever it may be. Getting early referrals to a mental health expert, and not just a psychiatrist who can prescribe medications, but a therapist who can help talk you through whatever your trauma may be. And just having sickle cell may be very traumatic. Having a stroke when you're a child is not a normal thing. And
Mhm.
a lot of patients who've had strokes at a young age can develop mental and cognitive issues. They may be behind in school through no fault of their own. This is part of their illness. And
Mhm.
unfortunately, others may not know or see that. They just make assumptions. Um, And then social workers are very important too. Some social workers are trained as therapists. Others can focus on non-medical but very important aspects to care. Some of my sickle patients, they have to juggle more than others who are just dealing with an illness. They also have to juggle work and school, like we've mentioned, finances. And unfortunately, in our population here in Los Angeles, sometimes even food or housing insecurity.
Mm-hmm.
And so it's very hard to treat a patient who doesn't know when they're going to get their next meal or if they're going to have a bed to sleep in. So accessing all of those services, whatever is available to you, asking for help. And I think as providers, it's important for us to help bridge the gap, because I think what also takes a toll mentally is feeling like you're not heard, having sickle cell disease, telling people you're in pain and not being believed, being brushed off, being labeled as a pain seeker, and just witnessing the inequality in our healthcare system is not good for mental health. And so my message to all of the doctors and nurses and caseworkers out there is to be mindful of that and recognize that these patients go through a lot more than patients with other blood disorders that don't affect marginalized communities. There's a lot of resources for cystic fibrosis and hemophilia, but because of racial inequity, there have not been the same resources for sickle cell, but that is changing. Hematologists like Dr. Nugent down in Orange County, they lobbied hard in California to get funds specifically for sickle cell care and support groups. And so millions of dollars have been allocated specifically for care of this disease. And just ask your doctor what's out there. And if they don't know, tell them to phone a friend, because there are resources out there.
Do you have advice for family members that are trying to, or that are wanting to be that support system for that patient? Do you have any advice for them? Because I'm sure, they may not know how to help or what that patient may need.
It's very challenging. I would say talk to other families, because sickle cell disease is something by definition that runs through families. And so everyone's affected a little bit differently. So that's where I think the local, more personalized support groups can really help people, where you meet people who are from your community that are in a similar situation as you, who may have seen some of the same doctors, been to the same hospitals as you. They can probably advise you or give more practical advice, where they had a good experience, where there are clinical trials. I think if family members want to help, because patients with sickle cell, they're not feeling that well. They're not going to want to navigate the system all the time to, try to find medical care. There are different tools online through the American Society of Hematology, through clinicaltrials.gov. If you just type in sickle cell, it will tell you which clinical trials are open in your area. In LA County, for example, it'll tell you all the major hospitals that have clinical trials, investigational treatments for sickle cell. But I think, if they want to help in terms of the medical care, ask your doctor about gene therapy, ask your doctor about stem cell transplant, and ask for support, because it does not have to just be you and your loved one. It can be, it should be your community rising up to help you.
Mm-hmm. Thank you, Dr. Ovesi. This has been so informative. Is there anything else that you would like to add that maybe we didn't get a chance to cover? Because this is a lot of information. I'm looking at the comments and I'm like, it's resonating.
I guess all I would say is that if patients and family members are like me, I was affected with a bleeding disorder and I happen to enjoy science. And so I said, I'm going to get involved in hematology. If you want to get involved, there are a number of ways. You don't have to become a hematologist like me, but there are opportunities to volunteer. There's opportunities to get involved in research and advocacy. You can lobby on Capitol Hill. You can go up to Sacramento and demand from your lawmakers to care about sickle cell. No matter what you do, where you are in life, and what your talents are, what your skills are, what job you do, you can always find a way to help to advocate for these patients who haven't really had a voice. And I found that that's been rewarding. Even though I don't primarily treat sickle cell, I treat mostly bone marrow cancer. It is all related, it's all blood. And I've had a lot of, I've had families tell me that it helps to know that someone has been affected by something similar. So if you want to make a difference that way, it can be very powerful.
Thank you, Dr. Obasi. This was super informative. Again, thank you for joining us and telling us about all the things you need to know about sickle cell. For more information on sickle cell, you can check out the resources that Dr. Obasi mentioned, and head over to blackdoctor.org for articles and other resources. And make sure that you share this video with your network, because it could impact someone, and someone could be looking for this exact information, and this will be helpful. So thank you again, Dr. Obasi, for coming on and chatting with us about sickle cell.
My pleasure. Thank you for having me.
Everybody else have a great evening.